welcome to Navigate Autism with Jane Lynn. I'm your host, Jane Lynn Britton, and today you're going to meet one of the most charismatic dentists that you've ever seen or heard speak, and he focuses in the field of pediatrics. This is very important. Just think of it for yourself. Do you like going to the dentist? It's something that most of us are afraid of doing. So how do you overcome that? And take it one step further. You have a child with autism. That adds another level of complexity. And I'm going to start by telling you my story. My son William was 4 years old, and we went to the dentist. It was a fairly big practice, and he's a toddler. So that in and of itself is very difficult. But add on to it autism. They couldn't clean his teeth. And when they came to me and said that they needed to put him to sleep to clean his teeth, and that was our only option, I knew that wasn't going to work. So what did we do? We stopped going to the dentist. William is allergic to everything, chemicals, environmental things, everything. How could I say, yes, we're going to put him to sleep twice a year just to clean his teeth? But I was afraid. What do? I wanted his teeth to be healthy. I wanted him to be healthy. So I prayed and I cleaned his teeth myself. And then about 5 years later, he started doing something really interesting. He would go into the freezer and find the ice packs and hold it up to one side of his mouth. And at first I thought he was playing, and then I realized he was doing this a lot. And I started getting scared. What do I do? He's got a dental problem. Where am I going to go? And I was really so scared. My husband had to calm me down. It was a Saturday. Almost everything was closed, and I was even more nervous because of that. So I went to the internet and I looked up pediatric dental practices who focus on special needs. And I found about 5 in my area. And the advertisements looked really nice and calm and loving and supportive. So I started calling. Everyone I called was not friendly, put me at the bottom of the list, said maybe we can work you in later in the week, and didn't really seem to care about me or my son. I didn't know what I was going to do until I called the 5th one. And that person stayed on the phone with me for at least 20 minutes, not only assuring me that they were going to work me in on Monday morning, but really spending time with me, calming me down, giving me ideas of what I could do to help my son, and I knew I had found the right place. So we went in on Monday, and of course I was nervous, and William was nervous, but we got through it, and we've been going there ever since, and we have a fantastic experience. So I knew that I needed to introduce you to the man who created this phenomenal practice, Dr. Brunsden.
Thank you very much.
You're welcome. And now let me tell you about Dr. Brunsden. So not only is he a dentist, but he started off as a 6th grade teacher. And then he was a science teacher and then an assistant principal. And you can tell he loves children because as he became a dentist, he then focused on pediatric dentistry. He's also the chairman of the New Jersey Dental Association, and as if that's not enough, he has started a pediatric unit with Rutgers. Mm-hmm. So you're very active in pediatric dentistry, and we are very grateful. So thank you.
Thank you for having us here. KidzDent, I'm their representative.
Yes.
What an inspiring story to hear you tell your story as one individual. Our practice has been dedicated from day one to trying to respond to the needs of the people that we serve. Years ago, I heard that we should do unto others as we want them to do unto us. And I kind of disagree with that because as a provider of dental care for children and their parents, we believe that we should do unto others as we know they want us to do unto them. Because our practice is dedicated to them. It's not dedicated to us. We want to do everything possible, take care of the child and the parent. And that's why we founded KidzDent. What it is today is not what it was in 1980 when we started. It has evolved. It continues to evolve. It's constantly changing to meet the needs of our patients. And that's kind of how we ended up taking care of autistic children.
Well, I was going to ask you that, but before we do that, could I ask you how you chose dentistry? I mean, you were in the field of education, and then you went, what led you to be a dentist?
Well, it was interesting. I was teaching science. I've always loved science. I was working on my master's in physiology at night while I was teaching elementary school and working as an assistant principal. And I actually met a lot of people who were going to medical school, dental school, pharmacy, ophthalmology, because we were all in the same healthcare program. And just spending time with inspiring people directed me towards dentistry, because a number of them were telling me why they were going. And I kind of fell into that feeling with them. So never really had a plan in the first place. And I counsel lots of young people. I tell them, you don't need a plan. What you need to do is just keep going forward and make today a better day than yesterday in everything that you do. And the end result will be that you'll find what you want to be.
Exactly.
It's just got to keep going.
I believe that too.
I was lucky I ended up in dentistry. I was really fortunate to pick pediatric dentistry. I mean, that to me was very powerful, basically because of my background. Elementary education, child psychology, it had to be applied somewhere. And I believe our whole approach to children's dentistry is founded on that education.
It really is, because I look at it as a holistic practice that you have. I mean,
Yes.
most of what you heard me say was, yes, we took care of William, but that was just one small portion.
Correct. Yes.
It was mostly me
Yeah.
that got me over the hurdle.
Correct.
And I've told you that I do a lot of role modeling for him. So I want him to feel comfortable. So let me do it first and let me feel comfortable.
Right.
And he can feel that.
Yeah.
Right? And
Yeah.
then he sees that, yeah, this is a cool place. My mom feels good.
Yeah.
She's excited. He relaxes.
Yeah.
And everyone thrives in the process.
Yeah.
So
I had a faculty member years ago who said to me, don't forget, attached to every tooth you're treating as a real life human being. Now we've learned that attached to that real life human being child, there's a parent equally involved. And we are caring and treating the entire family with every child that we treat. And it's very important. In fact, I get most of my lead on how to manage the child from the parent. I have questions that I ask. I have a behavioral assessment concept where we interview the parent before we see the child. Particularly powerful with the autistic population, because we need to know who that child is before we go near them. So the first 5 or 10 minutes of our meeting is parent to doctor. And the child takes their time to acclimate themselves to the environment, familiarize themselves with us, and get used to us. We don't get in their face. In fact, when we go into the room, we sit on a chair lower than the child. We don't want to be intimidating. We want them to become comfortable with us. As anybody with an autistic child knows, they pretty much direct what's going on. You kind of just assist along the way. But most of the time, we let the kids get familiar with us. While we interview the parent, we get a lot of good information, and then we can proceed with some guidance. It's a really good way to do things.
it really is, because you're creating that warm, comfortable environment, but you're building trust.
Absolutely.
And to get them into the chair
Yep.
to help them, you need that trust from the parent
Yeah, correct.
and the child.
In my written script concept of introducing yourself to an autistic family, the part that involves the parent is referred to as the trust conversation. It's very important that the mother know that they can trust you and follow your guidance and go down the path that you wish to bring them towards success and health care for their child. Because it's a very complex world for all children, not to mention children that are diagnosed with autism. But every one of them is unique and requires their own custom-tailored approach so that they can be successfully treated. And that's kind of how we've evolved.
Right.
They didn't teach me this in dental school, by the way.
No, I'm sure they didn't, because the thing that really sticks out of my mind, and I know you live it, is you're asking the parent about the child, because so many times we don't get that. It's like, I'm the professional, I know my craft, let me tell you the best way to do it. And we know so much. I can tell you what will motivate William to sit in that chair and what won't. And so when you're listening and your dentist listen, it creates a successful experience.
Yeah, absolutely. And my listening has been very beneficial. I've learned so much from parents. Some of the children that we treat, we need to give them a mood-altering medication. This is a mild sedative just to take the edge off, not to put them to sleep, but to help them deal with the issues that we have to deal with. And sometimes it's a liquid, sometimes it's a pill. And I always ask the mother, how do you give your child medications? And one mom said, give me a straw. And she would put the straw in the liquid, put her finger on top, lift it up, put the straw in her child's mouth, down the back of his throat where there is no taste, and down goes the liquid. She had trained him with, and she said, I did it with fruit juice first, and now I do it with all the meds that he needs.
That's smart.
Fabulous.
Right.
Another mother said, I always use pills. She puts it in a straw, puts the straw in his mouth, and blows it down his throat.
Oh my goodness. I would never have thought of that.
I wouldn't either. I wouldn't either. But the stories I get are amazing, how people are willing and creative enough to come up and solve every issue that's necessary for their child.
Right.
It's fabulous.
I love it.
Yeah.
And you're learning and we're learning
Every day.
together.
Yeah.
So what is it that led you to autism? Because, I mean, obviously you know a lot about children, but I've seen how you actually take, well, I think it's a little bit different approach with the kids with autism.
Yeah.
So that took some inspiration and desire.
It truly did. Inspiration, desire, and experiences, some positive, some negative. But I can tell you this, I graduated dental school in 1979. I specialized in pediatric dentistry, and I specialized in dentistry for special needs children. I never heard the word autism till the mid-90s. I had already been practicing 15 years before the word became part of the vernacular of anybody dealing with kids with special needs. And so the evolution occurred at that time because I have a requirement to provide healthcare services to every child who comes in my office. And I need to figure that out. There's nobody but us that does that. So I came out of dental school learning how to take care of teeth. I learned after dental school early orthodontic care for kids, behavioral management, sedation dentistry, more advanced concepts. And that evolution led me to the point where I'm now allowed to provide all care to all patients in my office. And that's been my driving force. Autistic children arrived in my office. I am now obligated to learn everything I can about them and how to manage them and how to successfully deliver dental care. And that's what we do.
Well, I love that you say obligated, but I see it as more you feel just inspired to do it. I mean, you want to be the best that you can, and you're doing that through your love of kids and wanting to give them the best care.
Yeah. Well, I can tell you the most life-changing experience in my professional development was learning to manage autistic children, because everybody in my practice has benefited. My staff is inspired, and they're now champions for the cause. My patients that come in are better served. Myself, I learned so much from the autistic community that I apply it now to all patients, because all patients have the same needs, and they're all just at different levels. Everyone has unique communication systems, verbal systems. Everybody has levels of patternism and repetitive behaviors, and we kind of go into that area and use that as a power to assist parents and children in managing their lives. So that's been healthy for us.
It really is amazing, isn't it? The things I homeschooled my son for 8 years, and it's everything that I learned to do for him. I have a daughter, as I told you, who's in college.
Yes.
I would kind of do it with her, and it worked just as well.
There you go.
So it's really, I think it's about how to connect with people.
Yes.
How to understand that we are different. We have individual needs and interest and things that work best, and you're open to listen and learn and go with that. So,
well, as a teacher of young children, we learned early that modeling is the most powerful tool for children to learn. And if you provide them with a really strong environment that is disciplined and directed towards goals, children are going to, by nature, follow them. They're very visual, they're very vocal, and they're not very verbal. And I find so many of my parents, and this is really to the public out there, trying to talk with words to explain behaviors to children. And it's really a process that doesn't do well with young children because of the fact that they're visual and they're vocal. It's the tone of voice that you use. It's the way you get caught up in what you're saying with them or directing them to that they pay attention to, not the words. So as a teacher, we developed systems. We used to call it tangible education. Get children to be physically involved with what's going on, get them to be part of the process and not be lecturing and talking down to them in that way. So we've learned to do that with all our kids, and we're a very active, energetic, and physical practice, as you've seen when you come in.
There are
very
videos.
Interactive.
Yes, you're on Facebook. There are videos of you all doing all kinds of fun challenges, and you dress up for Halloween. I mean,
we dress up for everything. You name it, we're dressing up.
Well, that's good because it creates that fun-loving environment. One of the things that I think was really interesting for me was watching the dentist and the steps they take with William. Now, you say you'd probably do this with everyone, but would you mind just explaining that? You talked about the intake process, but when they sit in the chair, and I'll just get you started to give you an idea of what I'm talking about here, but before anything went in his mouth, the dentist would show it to him and would do it on themselves. Or I'm going to count your teeth while you're actually sticking the thing in, I don't know what it's called, in their mouth.
We have a number of systems that we use. One is called TSD, Tell, Show, Do. We tell them we're going to brush your fingers. We show them the toothbrush and we brush their fingers. It's very innocuous, it's very simple, and it's certainly not threatening. And it is only a toothbrush. However, in the autistic community, we'll frequently get a pullback. Now, that doesn't stop us because we also apply the principles of applied behavioral analysis. The ABA system of going one step forward, one step back, two steps forward, one step back, it's a progression leading towards a desired goal. Our goal is simple. We need to get into the child's mouth. We need to get in there and find out what's going on. And we use that process to assess their behavioral response. So we have a grading system. We begin with the fingers, we work our way through. It's called gradual systematic desensitization. It's kind of rapid. The kids get it because they're used to it from school in most cases. And we can rapidly go through the process of getting the child's mouth examined and their behavior assessed. Once we've done those two things, we now know what we need to do to make this child healthy, and we now also know what we have to contend with. And then we match that to the system of behavioral modalities that we have available, which range from simple things like just brushing their teeth and cleaning their teeth, perhaps using a mouth prop to help open their mouth, maybe using some light, gentle wraps to control their arm and leg movements, which they're very, very comfortable with because they're out of control when they're not comfortable. And we watch the kids relax when we do that. Maybe we'll give them some oxygen mixed with laughing gas to relax. We can also use mild sedatives. And we also have, for the most advanced situations, IV anesthesia. All of that's available in our office. You don't have to go anywhere else. Yeah. In addition, we have a very advanced orthodontic department that provides early orthodontics and advanced orthodontics all the way up to adulthood. And we can then provide the orthodontic needs that these children have as well, based on their behaviors, of course.
Right, and I think I remember talking to you earlier, because I mean, a fear of mine is, what if William needs braces?
Yeah.
And you know, he won't even put let a Band-Aid stay on his skin.
Yeah.
What's he going to try to do with those braces?
Correct.
But I remember you saying, well, start early.
Yes.
And get used to different things in your mouth and different feelings, and you build to that. And you've had success.
We've had great success with children, bringing them to the highest potential that they have within themselves. And this is all kids. The key is to start early and be repetitive and be patternistic and play into the strengths of children. Habit creation requires repetition. You can't just say, I'll walk into the dentist when my child's got a problem and now you need to fix it. That's a little too magical for me. We need to be a little bit more systematic. Kids need early dental intervention, just like they need early intervention for language and behaviors. Dentistry is a required necessity of life. So you need to start the kids early. You need to keep coming consistently, and you need to build on the strength of that. With good luck, we can provide orthodontic care. But in many cases, you can't. And we know that that's not going to be a possibility. So we have developed in KidzDent a unique approach to that. When we identify that a child is not capable of having all those appliances in their mouth for 2 years with monthly adjustments, turns and twists, we go into a process called systematic extractions. It's a sequence of removal of certain baby teeth that allow the permanent teeth to grow into the more correct position. So we capture the force of nature in the growth and development of the child, and we actually guide the permanent teeth into the right place over time.
Interesting.
But the key for this, you got to start early.
Right.
You have to get into the program, and you have to go through that sequence, which usually starts around 7 or 8 years of age and finishes by age 9 or 10. By then, the adult teeth are coming into a better place.
Right. That's interesting. Well, my biggest thing right now is trying to get x-rays.
Yes.
That is not a comfortable thing for me.
Correct.
So imagine my son sitting still. And we haven't done it yet, but I think it's wonderful that my last visit was the dentist was brainstorming ideas. Took 5 minutes out of her busy schedule to say, well, let's figure out how we're going to do this. And we came up with a plan. Next time I'm going to call 5 minutes before I arrive. They're going to clean out the office. We're going to go straight in.
Yes.
And we're going to try it.
Gotcha.
And if he doesn't do it, we'll do it next time. But she said, come on this day at this time because it's not busy.
Yes. And
we have a plan in place.
Yeah.
So
well, we've developed 2 new technologies that we use. One is we have a device that takes all the x-rays from the outside of the child's face.
And that's the one that goes around
around your head. Right. Nothing goes inside the mouth. So as long as we can get a child to stand still, by hook or by crook, and we can also do it in stages where we can do the right side and then the left side. So we can do that. In addition, we now have a portable handheld unit, so we can actually take the pictures anywhere you are in the building. So we can sit a child down at a side chair where they may not be so threatened, and we can put a film on the outside on this side and shoot from below here and get the picture on this side.
Do they
with
bite on
nothing
something?
inside. They don't have to. You just hold the film here
I
on
love
their
it.
cheek, and you take the film from this side, and it illuminates it here, and you get a copy of the teeth on that film. So we have a lot of techniques and tricks that
That's
we've
what I
developed
love.
to make this happen.
I love that,
Yeah.
and the creativity behind
Yeah.
it, because
Well,
these are important things. Like
yeah.
I know that his teeth are now getting crooked.
Right.
He's 17. He's going to start getting wisdom teeth.
He might, yes.
And what do we do with that? Today's Minute for Health, I wanted to share with you something I've been reading about blueberries. We all know that blueberries are so healthy, but did you know that blueberries from Maine actually help the brain? What I've been reading is that they can help reverse Alzheimer's, not the big ones, but the little tiny ones that you find in the lower bushes. So when you look for them, be careful. Don't buy the ones that just say blueberries from Maine, because they could be distributed from Maine but come from another country like Canada. Make sure you get the ones that are grown in Maine themselves. But I don't know about you, it sounds pretty amazing, and I'm definitely going to try it. I would love for you to share some of the things that you've done in your office to make it more sensory friendly, because
Okay.
a lot of our kids can't handle the noise and
Right.
the lights and the other people.
Yes.
So you've done quite a few things.
We have done a number of things, but it really begins with the phone call. We have a script so we can ask the parent about their child, so we can match them to where in the office we're going to see them. Some of our kids are totally mainstreamed in the typical population, which a lot of parents desire that, but we need to identify that on the phone so we can schedule them into a mainstream location. Others require total privacy with a very experienced practitioner to do the exam, so we identify that on the phone. Now, if somebody requires solitude, quiet, away from the crowd, we have a separate part of the practice that's totally secluded, very quiet, a private waiting area, and those children could be in a peaceful place. We've also surrounded the facility with adaptive, interactive games and toys. We have beanbag chairs, we have squishy toys, we have bead games, we have all sorts of things that captivate the minds of our patients and relax them. And we learned about all of that from the world of autism. You just have to go on Amazon and look at all these things on our adaptive toys for autistic children. You'll see all of those types of things, and they're very, very beneficial. And my entire practice loves them.
Oh, I'm
So
sure.
It's a great thing.
Well, I want you to
Yeah.
know it has been helpful for me, because there's always a survey we fill out at the end,
Yes.
and you pay attention, because
We
I said
do.
one of my experiences, it was too sensory for William.
Gotcha.
The very next time we were scheduled to that office space upstairs where
absolutely.
there was no one.
Yes.
And now every time we go,
Yeah.
we have our own
Right.
office, and they know him.
We're 100% responsorial to the needs of our patients as long as we know what they are.
Right.
Sometimes we try to guess what they are, and occasionally we might not be right. But as long as someone speaks up and lets us know, it goes into their permanent record, and we're going to stick with that and follow that protocol, because the reason we're doing this is because the behavior of the child is determined by that. And we can't successfully care for them unless we solve all the challenges.
And you're doing it.
We are.
We've been
are.
coming back and
Yeah.
had very good experiences, and I'm hearing the same
Yeah.
from other parents.
Yep.
So one thing I like to do
Yeah.
is to share at least one or two things that parents can do right now. Now, I know you have a lot of videos on your website.
Yes, we do.
Which is great, because
Yes.
you're showing how to brush teeth, how to keep their arms down.
Yes.
But could you share one or two things right now?
I can.
do?
We have a brochure in our practice, and it's our special needs dental care brochure. We realize that autistic children, any special needs child, is at an increased risk for dental problems. Now, one of the things we know is they're very orally sensitive. Consequently, they don't permit brushing or flossing. So we need to come up with tricks that help us get through that impasse, because we do know this: dirty teeth get cavities. So we've got to get the teeth cleaned, not just the outside of the teeth, but in between them as well. And sometimes that's totally impossible. So how do you get into that area of brushing a child's tooth? You take a toothbrush, you brush their fingers. You brush their front teeth. No toothpaste, just a wet brush. You see how far you can go. There are fluoride rinses that you can buy that are all different flavors. You can dip the brush in a fluoride rinse instead of toothpaste and brush. But I can tell you this: you could brush your child's teeth with chocolate syrup and clean them very, very well, because it's not the syrup that causes the cavities. It's not the sugar. It's the bacteria on the teeth. So if there are flavors that your child likes, that's a great way to introduce yourself into brushing by making it seem as if you're actually giving them something they like.
I never knew that.
If you
Isn't that
convert
amazing?
that into mixing some fluoride with that substance, you're now giving a fluoridated, flavored, homemade paste that the child likes, because we need the teeth scrubbed. Get those teeth scrubbed. That's key. If you can't get past that, then we recommend that you keep the sugars out of the mouth, because the bacteria on the teeth are eating the sugar. That's what causes the cavities. So that's something that a parent can control. And to me, that's where we really have to get into caring for kids. The only drink that should go in their mouth is water. And it's interesting, a child is supposed to get 50% of their weight in ounces
In water?
per day. So a 100-pounder is supposed to get 50 ounces. Taking an 8-ounce glass, what's that, about 6 or 7 glasses of water a day?
Right.
That's a lot of water. Guess what it does? It helps your immune system.
Right.
It calms your gut. It reduces weight gain. And it takes away hunger. And it takes away appetite in between meals. So we need to get into the old world of how people ate when they were really healthy, and not live in the world of our modern, sad American diet, the standard American diet. So break away from liquid sugars, break away from sugar snacks. We have a lot of parents who leave little plastic containers of different healthy snack foods around the area where their child plays or spends their time. You can put cucumber slices, grapes, carrot sticks, sliced apples, and just leave them there. Don't say a word. And you'll watch your child gravitate to snacking healthy snacks.
Love it.
That's how you do it. So these are some of the things. Now, another item is that we find a lot of parents are afraid to take their child to the dentist because of your preconceived beliefs about how that child might behave. Bring them to the dentist. We'll help you deal with that.
Yes.
We'll get you over that and get you into a real approach to caring for your child. That is key.
I love that. I wish we had more time, but we have run out. There's so much that you can share with us.
Absolutely.
And your passion.
You need a
is
longer
outstanding.
show.
I do.
This is crazy.
Maybe you
this
can
is
come
important
back.
stuff.
It is important. Well, that's why they need to come see you.
Absolutely.
And like,
Yep.
it is always a pleasure to
Yep.
talk with you. Thank you so much for joining
I really
me.
respect you immensely, and thank you. Not for what you're doing with Navigate Autism, which is amazing, but for welcoming me on board your ship and taking me on a journey to where we all need to know we have to go. We need to care for others. That's the best thing you could do in your life.
Thank you
very
so
much.
I appreciate that as
Yes.
well. And definitely, if you're looking for a dentist, look no further than KidzDent. As you can see, you're going to get the best treatment. And as long as you tell him what you need,
That's it.
they'll
That's it.
take care of
Yep.
it for you.
We're here for you. We're your servants. That's what we do. We serve others, and that's the whole story.
That's it.
Yeah.
Wonderful.
Thank you.
Thank you. And thank you so much for watching. And I look forward to seeing you next time on Navigate Autism with Jane Lynn.